With that, I'm going to hand over to Professor Folarin and say a huge thank you. We're so excited to have you. We feel some capacity here. We're so excited to have you and really welcome you to join us now. Thank you so much, Professor Folarin.
Thank you very much, Dr. Eka. Let me first of all express my gratitude to Dr. Eka and all the organizing committee for this invitation. I apologize I could not be there physically because of the important exercise that is ongoing in the country, which is the election process that is presently ongoing. So without wasting so much of our time, I'm going to go on into the presentation. And please permit me to stop the video in order to improve the quality of the presentation. So my presentation as given by Dr. Eka is on global public health and innovation in Africa. And what I want to present today is to talk to us about genomic surveillance for pathogen discovery and vaccine development by Africans in Africa. So I want to just demonstrate what we do at African Center of Excellence for Genomics of Infectious Diseases. And we are based at Redeemers University in Ede, Nigeria. So what brought about the African Center of Excellence for Genomics of Infectious Diseases is the fact that we observed that there's a genomics revolution as a result of the completion of the Human Genome Project. And we saw that it has revolutionized the way we approach healthcare and research. But unfortunately, what we also observed is the fact that while this revolution is taking place and it's been used to the benefit of mankind in developed countries, it is not yet available to African scientists and patients. And so based on this knowledge, and also the fact that if you look at this map, I will say that Africa is blessed. I'm sure a lot of us will probably not want to agree with us, but you see that most of the infectious diseases are found in Africa, and a few are found outside Africa. And so that is the reason why Africa should take the lead and take the front seat in terms of finding solution to the challenges of infectious diseases. So with all of that at the back of our mind, that's what brought about the African Center of Excellence for Genomics of Infectious Diseases. It's a World Bank funded center of excellence, and it consists of long-standing research and training partners within Africa, and also other global partners like the Harvard University, the Broad Institute, Tulane University, Stanford University. We also have partners in the US Department of Defense and then University of Cambridge. And we also have industry partners such as Illumina, Cogenics, and Dimaji. So all of these partners come together to see how genomics can be transferred from knowledge of genomics, and the technology can be transferred from the developed world to Africa in order to address the challenges of infectious diseases. So what is our mission and goal? Our mission actually is standing on two legs, which is the education goal and the research goal. Our education goal is to create a vibrant academic and research environment that is free of outside influences and that transcends national boundaries and ensures the conduct of relevant, responsive, ethical, and high-quality translational genomics-based research on health in Africa by Africans. And for our research goal, we hope to be able to characterize fevers of unknown origin through microbial metagenomics. I'm sure we all know that one of the major symptoms of any infectious disease is fever. And in most cases, when patient goes to the hospital, what they are told is to go and get tested for malaria or typhoid fever. And even when they test negative for this, it is being seen as maybe the testing system is not working properly, and they still provide anti-malaria drug. But then one of the things we have seen over the years since the establishment of ASGID is that there are a lot of pathogens in the circulation that we are yet to explore. So our mission actually is such that it is using education and research to develop capacity in the field of genomics among African young scientists. So all I have been saying since is that ASGID hope to be able to develop the next generation of African pathogen hunters who would hunt down these pathogens rather than the pathogens hunting us down. And we hope to be able to transform outbreak response in the pathogen genomic era. So how did we start? Actually, our test of excellence started in 2014 when we had the West Africa Ebola outbreak that started from Guinea and came all the way to Nigeria. And before it got to Nigeria, one of the things that we did was to sequence about over 200 Ebola genomes. And from that sequencing, we were able to develop, have a full genome from 99 samples. And all of these samples were immediately deposited in public database for secondary data use. And I will talk about what the secondary data use actually resulted into. In addition to sequencing, we also immediately found a way to reduce the turnaround time of whole genome sequencing of these pathogens from what could have taken us about 2 months to something done in less than 10 days in order for us to be able to quickly generate these genome sequences. So immediately after the genome sequence is completed, we also make sure that we upload on public database. And this is something that is very unprecedented because we were the first set of scientists that were releasing sequence data in the public database for secondary data use. And this was published in Science in 2014. In addition to the large database of Ebola genome sequences, we also tried to understand what was going on in Sierra Leone with the Ebola outbreak. And one of the things we saw was that there were 4 different types of Ebola viruses circulating within the country. And we also saw that there was sustained human-to-human transmission, but then there was no additional zoonotic introduction from the reservoir. So what this means is that the reservoir, the animal reservoir, only transmitted once, and then the human-to-human transmission was sustained during that period. And then we use our genomic information and tools to be able to understand, for us to be able to carry out surveillance of these Ebola viruses within the region, and also to understand the transmission and the spread of this virus within the region. As you can see, you see how this spread started, and then it went across the region between July 2014 all the way to December, and then it cuts across all the way to 2016. So that's how it spread, and it was one of the tools that was developed to be able to understand the transmission pattern. In Nigeria, as you know, we had the shortest period of the outbreak, and what actually helped us was the fact that we immediately got on board and we tested the first case, which we refer to as the index case, and also immediately sequenced the genome of this index case, as well as the virus also obtained from all the other cases that were confirmed. And when we compared the genomic data, as well as the dates from which they were detected in the individuals, and compared it with the contact tracing pattern, we saw that there was an overlap between the genomic data as well as the contact tracing. And this gave us a form of a confidence that we can actually use genomic data to understand disease epidemiology, as well as the evolution, as well as transmission dynamics of pathogens in a community. Aside of carrying out these sequences, remember I said that we immediately submitted these sequences into public database. And in addition to allowing other scientists, like for vaccine development, diagnostic kit development, SGID also used the sequence data to develop the first Ebola rapid diagnostic test kit that can detect this virus within 10 minutes. And this has actually been approved by WHO and US FDA for emergency use. In addition to the rapid diagnostic test kit, we also developed an ELISA kit that can detect antibodies and antigen within a short period of time. Prior to Ebola outbreak, we have been involved in Lassa virus research. And what we have been doing over time before then was to try to understand the virus and then the disease that it caused. You will agree with me that this disease has been with us for well over 50 years, and we had limited information about the genome. And so we carried out next generation sequencing of the genome, and we're able to actually characterize the virus. And also we submitted all of this sequence data into the public database for use. We were able to develop the largest Lassa virus genome database of well over 400 genome. And using the information from the sequence genome, we actually trace the origin of Lassa virus across West Africa region. And one of the things we found out is that the virus had actually been in circulation in Nigeria for well over 1,000 years. And then it cut across the region to go to all the other countries like the Ivory Coast, Sierra Leone, and also Guinea across the Mano River Union. In addition to tracing the origin of Lassa virus, we also use the sequence data to develop a rapid diagnostic test kit also, which also has been approved by WHO and US FDA for emergency use and can detect the presence of the virus within 10 minutes. In addition, we also developed an ELISA test kit as well. In 2018, we had a situation of a Lassa fever surge where we had an unprecedented increase in the number of cases of Lassa fever confirmed cases in Nigeria between January and May 30 in 2018. And we had about 1,000, almost 2,000 suspected cases across the country in 21 states across the country. And within that period, 497 were confirmed. And this gives us a 25% case fatality rate. And so we started asking questions. Is this a new variant that our diagnostic kit is unable, or diagnostic method is unable to detect? Is it a more virulent strain? Is human-to-human transmission increasing? These were the questions that were on our mind that we kept on asking, that why do we have this kind of increase? If you look at this chart, you can see that there was a very sharp increase in 2018. And so at SGID, we decided to isolate this virus and sequence them. That is this virus obtained from the 497 confirmed cases. And we sequenced them, and we had over 300 full Lassa genome sequences that were immediately deposited in public database for secondary data use. I'd like to say that at this point, all of these sequences were done in Nigeria by also Nigerians. And what did we come out with? What was the outcome of this sequence analysis? We observed that there was no evidence of a particular new viral strain. There was also no evidence of increased or sustained human-to-human transmission. But what was observed is that there was multiple introduction of genetically independent viruses similar to known lineages in Nigeria from the animal reservoir. At this point, I would like to say that in Nigeria, we had 3 different lineages circulating within the country. We have the lineage 2A and 2B, and also lineage 3. And then using the genomic data, sequence data, one other thing that we saw that was quite interesting for us was that these lineages were clustered within a particular region. You can see from this map of Nigeria, we have the lineage 3 clustered in the central part of the country. We have lineage 2B clustered to the south-south region. And then we have lineage 2A around the south and also West African region. And what we saw was that there was no cross between, we could not find lineage 2A where we had lineage 3. And our suspicion is that there are 2 major rivers that kind of divide the country into like 3 parts. We have the River Niger, and then we have the River Benue. And it shows that this river kind of served as a hindrance for the mastomes, which is the animal reservoir, from moving from one region to the other. And that was quite interesting for us. So the outcome of that sequence data, we immediately shared it with the Nigerian Center for Disease Control in order for them to, for that to affect policy in terms of management and control of the disease. And like I said, this was released openly for scientific community in real time. And the other question that came to our mind was, okay, so what is exactly going on in the rodents, which is the animal reservoir of this virus? So we went hunting for these rodents and to see whether we can actually detect the virus within the rodent, and also try to understand the genetic diversity of this virus within the rodent. And one of the things that we found out was that the rodents actually harbored this virus, and there was no diversity between what is present in the animals, in the rodents, as well as what was found in the human being. So the summary of all that we have been doing, which is also centered around the title of my presentation today, is that we have been using metagenomics of clinical samples for the identification of pathogens based on genomic sequences to develop countermeasures such as vaccines, drugs, and diagnostics. And what have we done so far? One was in 2016, 2017, we actually discovered 2 new rhabdoviruses in the blood samples of healthy individuals in Nigeria. And apart from discovering these 2 rhabdoviruses, we also went back to the community where these rhabdoviruses was identified and detected, and we carried out seroprevalence among the individuals within the community, and we found out that most of them had developed antibodies to these 2 new rhabdoviruses, and this was published in PLOS Neglected Tropical Diseases. So we have been able to identify new pathogens. Aside of that, we also use the metagenomic analysis to actually identify a yellow fever outbreak in Edo State. And what happened within this period was that some patients were affected and they were showing some hemorrhagic fever. And in fact, some of them actually died, but then we didn't know what was affecting them. They were tested for Ebola, it was negative, tested for Lassa, it was negative, and what the samples were sent to us at SGID, and then we use next generation sequencing as well as metagenomic analysis to detect what was the pathogen. And we realized that it was a yellow fever that was an outbreak within the state during that period. Also, this information was transmitted to the Nigeria Center for Disease Control, and they immediately started vaccination of the people within the community. one other interesting information that came out from these genomic sequences was the fact that the Nigerian samples were closely related to sequences from other West African region, as against the old samples that were earlier sequenced within the country. And the question was it that someone traveled from Senegal to Nigeria during that period, or just the fact that we didn't have recent yellow fever genome present within that period, and which was the most likely event, because what we had then and that we could compare with the 2018 outbreak was yellow fever genomes obtained in 1946, between 1946 and 1991, which was a wide gap. And in the spirit of One Health, from our experience with Lassa, we also now are hunting or carrying out a surveillance of other zoonotic diseases. And we were able to carry out a genomic characterization of the first rabbit hemorrhagic disease in sub-Saharan Africa. This was led by Dr. Anis Happy, who is a vet pathologist. And we have other team members of the zoonotic team who go out to trap these animals and also collect samples for sequencing. Our lab, that is the African Center of Excellence for Genomics of Infectious Diseases, is actually endowed with a lot of infrastructure. We have both human infrastructure, and then we also have equipment that we use, ranging from the automated extraction equipment all the way to the testing, the qPCR machine, as well as a wide range of Illumina sequencing systems, such as NovaSeq. We have the NextSeq 2000, we have the NovaSeq 6000, and then we also have the MySeq as well as the iSeq 100. In addition to the Illumina sequencing tech platform that we also have the ONT platform, where we talk about the Oxford nanopore technology sequencing. So what did we do in the ongoing pandemic, even though I believe it has gone down significantly globally? So the first case of SARS-CoV-2 was actually sequenced by us at ASGID, and we were able to sequence within 48 hours, actually after receiving the sample on 1st of March. And just as our practice, we carried out analysis to see how related this virus was with other viruses that had been sequenced. And then we found out that it was closely related to what was circulating in Italy. And that actually confirmed the fact that the index case came from Italy. And it was also related to the very first genome from China. And as usual, we also submitted this sequence data to GISAID, and it's now also being used. And over the period between 2020 till date, we have been able to sequence well over 5,000 genomes of the SARS-CoV-2, and all of these data are available on the GISAID database. And we use the sequence information to develop a dashboard where we use to monitor the transmission pattern of this virus within the country. And you will see this playing out, how the different variants were identified at different times, and then how they also spread within the community in the country. Like I said, we have been able to sequence well over 5,000 genomes of the SARS-CoV-2, and we were also involved in testing of the virus in the heat of the outbreak, then in between 2020 and 2022. And during this period, we were able to test well over 20,000 suspected cases. In addition to sequencing for Nigeria, we also sequence for other West African countries like Cameroon, Burkina Faso, Tunisia, Rwanda, Somalia. And this is a chart showing the different variants that were in circulation in Nigeria. And you'll see we have Omicron, Delta, and then we also have all the other variants and lineages. And this is showing us a chart of the timelines of SARS-CoV-2 lineages between March 2020 and March 2022. And what we see is that as at this time, it's Omicron and Delta that was predominant. And also just confirming the recent lineages that is present within the country, which is the Omicron and Delta variants. So what have we done with the sequence information? Like I said, we want to be able to use it to develop diagnostic tools for rapid and accurate diagnosis. We also want to be able to understand the virus in order to be able to identify drug targets, as well as also identify a vaccine target. So one of the things we have been able to do is to use the CRISPR-based technology to develop what we call a Sherlock technology for a rapid diagnostic kit, test kit for the virus. And this is contrary or different from the common rapid diagnostic test kits that we know, because it is detecting the nucleic acid as against detecting the viral protein. So we have two of them. We have the SHINE, which is individual, and it's developed like the rapid diagnostic test kits. And this can be taken to the patient bedside because you can actually identify detect the presence of the virus within 1 hour. And then we also have the high throughput type of it, which we refer to as CAMEN, is also using the CRISPR-based technology, but then it's able to detect different type of or multiple genomes that may be present in the individual. For vaccine development, we have been able to use the sequence data to identify vaccine candidates. And these sequence data were used to identify vaccine candidates and have been used for development of vaccine that is currently undergoing clinical trial. So we partner with Cambridge University. We have partners in the scientists in Cambridge University who actually worked in terms of the development of the vaccine candidates, and as well as the development of the vaccine, and is currently undergoing clinical trials in some African countries. The essence of this is such to be able to develop vaccine that is indigenous for Africans. So going back to our mission, we said we want to use research and training to develop capacity in genomics within Africa. So we also are very much involved in education and training. And within the period of the COVID outbreak, we have been able to partner with Africa CDC, WHO, and also the Nigerian Center for Disease Control, and states and country Ministry of Health to be able to train scientists, public health scientists, and all of those principal scientists that are involved in the diagnosis of SARS-CoV-2. We train them on molecular-based technique for the detection of the disease, as well as next generation sequencing. So within that period, we were able to train 86 participants from all across the continent, and also that is covering 32 African countries. And one of the things that is unique about this training is the fact that the trainees actually come with their SARS-CoV-2 samples for them to actually run the sequencing themselves. So they had hands-on training experience on their own samples, as well as also carrying out bioinformatics analysis in order to understand the particular, to be able to identify the particular lineage circulating within their country, and also going forward to understand the transmission dynamics. In addition to training specifically for next generation sequencing for the detection of COVID-19, we also do an annual foundational genomics training as well as advanced genomics training. We also run a graduate training in molecular biology and genomics, where students can undergo a master's degree program or a doctoral degree program within the university in molecular biology and genomics. So we have an innovative program, which we refer to as the Sentinel. And this Sentinel, what is meant to do is for us to be prepared for any pandemic that may come. And what we are doing is we're hunting pathogens, detecting pathogens, and using the genomics information to be able to connect with scientists all over the world, and also to be able to develop rapid diagnostic test kits in order to empower public health scientists for continuous detection of these pathogens. So we call it a pandemic prevention and response program that helps us to detect, connect, and also empower scientists within the region. And so what we hope to do is we go into the field, we carry out genomic sequencing of pathogens, both those that are known and those that are new. And the information is taken by scientists to be able to develop rapid diagnostic test kits for accurate detection of this pathogen, should in case there is an outbreak or a pandemic. And then we use the knowledge to empower the public health community to improve pandemic preparedness anywhere in the world. In addition to that, what we're also doing with Sentinel is to build a connected genomics network in Africa, whereby we are developing and establishing genomics centers across the region. So far, we have been able to set up a genomics center in Senegal, in Sierra Leone, and Liberia. And in addition to that, we have also been able to establish molecular testing centers across the country in Nigeria. We also have been able to develop a dashboard that helps us to monitor any possible outbreaks, especially across the regions where we are partnering. So this is also the summary of our Sentinel. We hope to go into the community, identify pathogens, use the genomics sequences and information to be able to develop diagnostic test kits, and that will also now come back to the patients and be useful for detection, as well as any other countermeasures that may come out from the genomic sequences. As you know, we do have some key challenges. That is, apart from us at HGID, we believe that this is also a challenge, challenges that are facing genomic surveillance across the continent. One, we know that genomics is still complex. We are yet to actually unravel the whole information. And then we also are lacking in expertise, especially for data analysis. There's also the lack of standardization and slow pace of adaptation to the sciences, that is genomic sciences. There is poor enabling environment, and I put here power because I'm sure for those of us that are very familiar with Nigeria, that is a major issue for us. Then also, there is also the lack of political will and also misplaced priority by the government. And presently, there is the lack of biotech company for translation of data. So we do not have a biotech companies and industries that can help in terms of translating the data and the scientific information from these genomic sequences within the continent. And so we still depend on the developing countries. So what are my recommendations? I want to recommend that there should be an incorporation of genetics and genomics in the diagnostic technique to refine ability to predict future diseases, classify at molecular level for better diagnosis and prognostic precision. I'm sure we all believe that if we're able to achieve this, then management and control of infectious diseases would be significantly reduced. And then I also want to recommend the incorporation of genetics and genomics in the training curricula to build human capacity for the utilization of genomic tools to address future challenges. This also is very important because even if we have all of the technology, if there is no human capacity, then there is no way we will be able to utilize these genomic tools. And the combination of these two will transform Africa and Africa in general and get us into the genomics revolution train. Instead of using the locomotive, at least we're going to be able to use the fast moving train. And that will take us far with respect to infectious disease control within the continent. At this point, you see that all my presentation, I was saying we, because this is not just my work. This is a teamwork of scientists. And thanks to the visionary leader of Professor Happy, who actually had the vision and actually shared it with this whole team. And this team is actually beyond this, because we also have partners across the continent and within the country as well. So he actually, being a visionary leader, led this whole team and brought to fruition the African Center of Excellence for Genomics of Infectious Diseases. So I'd like to appreciate his effort and his leadership, as well as also our funders. We have the World Bank, we have WHO, we have the Elmer Foundation, we have the Audacious, as well as also our industry partners like the Illumina and Cogenics. And also I would like to acknowledge also our partners, the Redeemers University, who actually gave us an enabling environment, as well as all other clinical partners and our funders as well. We acknowledge their efforts for supporting us and also believing in us. At this point, I would like to say thank you. But if you have need for more information, this is our website, and also for more direct information, you can contact us at info.isgid@ron.edu.ng. Thank you very much for your attention.
Thank you very much for that, Professor Folarin. Really illuminating, and it's really fascinating to see the range of coverage there in terms of the work that's been done over time that has brought us to a place where we can be discussing the response to the COVID vaccine, which perhaps for many of us is the most familiar space for these sorts of conversations as social scientists, I should add. So with that, if I could invite Professor Anne Pollock to please offer some comments in response to that, and then we'll open for Q&A from the room here, but also colleagues online, please feel free to start typing up your questions there that will come to later. Over to you, please.
Thank you so much. I guess I hope that Professor Folarin can hear me well, even if I don't stand right by the microphone. Is that okay?
Yes, I can hear you.
Great, excellent. So thank you so much to Eka for inviting me, and to Professor Folarin for a really stimulating conversation. I mean, I think that this presentation is tremendously exciting. I think in part because it really foregrounds a lot of the cutting edge work that is being done in global health in ways from perhaps unexpected places. And I think that Nigerian scientists have been absolutely at the foreground of and at the forefront of a lot of the work in zoonotic diseases in particular, and highlighted here. And it's really a challenge to frame a response, of course, on the fly, especially to such a rich kind of presentation. There's a few things that I wanted to kind of pull out and highlight, perhaps as in part as a measure to translate from a scientific kind of presentation to questions that are really prominent within social science interested in innovation and science and development in Africa and beyond. So first of all, just to kind of step back a bit, I was really struck, just on a large level about the way that often when we talk about genetics and disease, people's first assumption would be that we would hear about genetic diseases, right? So that the reason that you would study genetics would be in order to study disease would be to study things like chronic diseases that might have genetic components. But as this presentation highlights, there are actually many more reasons why we might need genetic research in order to understand disease, because the genetics of pathogens also provides additional windows. Now, how does this matter kind of conceptually? One reason is that if you think about kind of the paradigms of research to health and development, one of the big kind of shifts that happened in the 20th century was a sense that there was a shift from infectious diseases to chronic diseases, and that infectious diseases would be located in the past and chronic diseases would be located in the future. Now, together with that, there was also a map of the world that kind of positioned different parts of the world within a different chronology. So an argument that those countries that still experienced infectious disease were somehow conceptually located within the past in this colonialist framework, and those with chronic disease were somehow located in the future in this framework. Now, HIV, of course, really challenged this kind of idea of a teleology, of a direction of disease from infectious to chronic, right? So the idea that, okay, infectious is still in the future. But it really has been transformed much more so since. And I think one of the things that's so compelling about the leadership of African scientists in zoonotic diseases that are infectious diseases and then the genetics thereof is illustrating the ways, like they're actually kind of starting ahead, right? So kind of being ahead of the paradigm that a lot of scientists in the global north and rich countries have been operating on, that assumed that infection was the past, not where the innovative science would be. Chronic disease was the future where innovation would be. I think we see here, innovation is absolutely possible and urgent and necessary in infectious disease in order to be able to understand risks to human health now and in the future and everywhere. And I think another element that's really showing the way that African scientists are at the forefront of global health developments is also with that zoonotic piece. So there has been a real anthropocentrism in understandings of health that have emerged. So that is to say a really human-centered view. Increasingly, the ideas are shifting to what's called One Health, right? Understanding the ways in which the environment, in which the animals, in which plants, in which everything around us, the whole world is interconnected. And so I think that this research is actually a beautiful illustration of the importance of that, right? We can't understand human health outside of its ecosystem, outside of our ecosystem, outside of the world that we live. And so I think that those are a few ways in which scientists in this group and others in Nigeria and others across the continent, although I would note that Nigeria is a real leader here, and that gets to one of my questions as well, really does make these scientists poised to lead, as long as epistemic hierarchies don't prevent it. I mean, I think that one of the real problems in global health publishing, in global health funding, and research is that it's very often assuming that good knowledge will be made in the global north, and the challenge is only to spread the benefit, not recognizing that what is also necessary is to kind of enable and get out of the way of the flourishing of genius, which is available all around the world. And so this kind of gets me to, I have a few kind of interrelated questions. So one of which is about kind of how this question between universal science and wanting to contribute to kind of a global good, and how that is kind of balanced with the idea that it actually does matter who makes knowledge and where. So Professor Folarin highlighted that it is appropriate that Africans study these pathogens because that's where they are, where the patients who are impacted are. But I wonder if there's more to it than that too, that it has something to do with is there a moral case there? Is there a political case there? Is there more going on? Or is this just about kind of proximity? So kind of what's at stake in Nigerian scientists and others on the continent contributing to global knowledge about zoonotic diseases that could in fact travel. A second question is about Nigeria and the specificity of Nigeria and the region. And the slide about power really brought this home for me because a lot of times, I mean, South African scientists will talk about how, yeah, you would expect Nigeria to be a real leader here, but one of the barriers, so in drug discovery, development and manufacture, which is the area that I look at, you would expect Nigeria to be a real leader, but power, the reliable power grid is a real barrier. So, if you want to do that kind of manufacturing, you really want stable power. And yet, there are other ways that Nigeria seems to be quite, have particular advantages within the continent and globally. So, these kinds of tensions around some regulatory and political challenges, but then how Nigeria is able to take such a leadership role in that context, something that I'm very interested in, and it might be of interest to others in the African Leadership Center space who are interested in countries and contexts across. And then the final question I wanted to raise was about that train metaphor there at the end. So, I was struck by the kind of vision of the trains. So the one kind of 19th century style train and the one 21st century style train. And I wondered whether there might also be other metaphors that we might think about, especially when we think about metaphors around technology in Africa, so which are often around leapfrogging rather than trains, right? So not around a grid of an infrastructure, so along landline telephones, for example, but ideas that by not investing in the technologies that are very place-based and very heavy and very, have lots of constraints, that potentially there might be opportunities for competitive advantage, but also for innovation and through leapfrogging, through skipping ahead. And if that's the case, what might we be skipping ahead to with these very promising genetic innovations in this lab in Nigeria? So I'll leave it there, but I really welcome Professor Folarin's comments and also look forward to hearing what you all think. Thank you.
Huge thank you to Professor Onikepe for those very, very insightful comments, really connecting us to the next step, how do we want to deploy some of what we've heard to allow us to think about many of us here thinking about, within the social sciences, development questions around politics as well, questions around governance as well, and of course, energy as well. So I think wonderful connecting threads there that allows all of us to think more deeply about what we've heard here. But as we wait for questions, please formulate those and hang on to those. As we wait for those, Professor Folarin, I wonder if we can come back to you for some responses to some of the questions that have come from Professor Pollock.
Yeah, first of all, let me thank Professor Pollock for that summary that he gave, and also to link it up to the social science world, and to also summarize the whole presentation. I like the fact that she talked about innovation in infectious diseases, that it's also very, very important in addition to chronic diseases, and also the emphasis placed on the One Health research. And I think that is where innovation is going, that we cannot be looking at human disease outside of the ecosystem. Well, with respect to a question, One, of course, is the fact that there should be, I can't actually rephrase the question, but I know she talked about how, what are the political situation within the continent and then within the different countries in the continent. And actually, that's one of the things I stated in the challenges that we're facing. African leaders are yet to get to that point to believe in ourselves. And I remember one of the things I mentioned to Dr. Eka in one of the interviews she had with me was that fact that African leaders need to start thinking inwardly and believing in African scientists, and also believing at on the innovations that comes from African scientists, rather than looking out for solution from outside of the continent. That is very, very important. And I would now link it up with the issue of the train system. So, and I think Professor Pollock actually rightly said that it doesn't have to be technological infrastructure in terms of moving on into the genomic revolution, that there should be a need to look inward in Africa and be able to develop innovative materials and indigenous materials, just like what we are trying to do with the vaccine, that it has to be indigenous, and it doesn't have to be something very massive, but it can start from something small, just like she's mentioned leapfrogging. I think she rightly got the word there, that we also, Africans, needs to look inward and address our challenges within the context of the continent, rather than using the technology outside the continent to address our challenges. So I hope I have been able to answer a question directly or indirectly. With respect to Nigeria, you rightly mentioned power, and that it's a big deal for us, and that actually is affecting our leadership role within the continent. And that's one of the things I would always give it back to Professor Christian Happy, who actually took the bull by the horn. So we have a very massive solar inverter system that is supporting the lab. Otherwise, we would not be able to survive and go this far based on even all of the things I have presented. But we have a very massive solar inverter system that supplies us electricity 24/7. And by next month, we will be close to 2 years that we have been on that system. But prior to that time, we had a small system that we're using, and also we depend on the generator system. But by and large, it's a major setback for scientists across the country that may want to even develop something close to what we have, if they don't have the support of all our funders. Like all our funders that we have may not actually be able to go this far. Thank you very much.
Thank you very much for that. So now I'm going to open up for questions. Any ideas coming from the ground? And also our colleagues online, please feel free to type your questions into the Q&A box or to the chat box, whichever you prefer. And I'll be sure to pass those on to our speakers, actually. But while I'm waiting for hands to go up, oh, I see one. Before I abuse my privileges, please, Maria, do you want to tell us who you are, and then?
My name is Munya from ALC, Nairobi. My question is to the prof for the wonderful work that they're doing in developing tools and everything. I want to know how far they've gone with their commercialization, and if there is any partnerships with the private sector, and how they wish to turn around their research into market-related products.
Thank you very much. Did you hear that, Professor Folarin?
Yes, I did.
All right. And then
Do you want me to?
Yeah, another question? So maybe we'll take these two and then we come to you, please.
Hi, my name is Alok. I'm a postgrad student at HSM. I have, my question is, first of all, congrats, amazing. It's lovely to see that Nigeria is right at the forefront of knowledge production in terms of genomic sequencing in the forthcoming pandemics. So my question is, even as Nigeria is producing this kind of knowledge in terms of sequencing, what is the world giving Nigeria in return? It could be as simple as access to vaccines, or funding, or other means of future development for the general public in the African continent. Also, are we looking, as we are producing knowledge, are we looking at probabilities of using artificial intelligence to play around in some way within these sequences?
Thank you very much for that. Professor Folarin, did you hear those questions?
I didn't hear his second part of the question.
Okay, so you heard the first one about the knowledge being produced. What is Nigeria getting in return for that? Yeah.
Yes.
The second question was to what extent is artificial intelligence being thought of or used in this space as well? Is that a fair representation of the
Okay. Thank you very much for those questions. With respect to commercialization and marketing of our products, we haven't gotten there yet, but because there's a process for any product that comes out, especially when it comes to application in health. You have to validate those the product as well as get approval. So with respect to that, we haven't been able to start talking about the commercialization and the marketing part of it. But what is happening right now is that WHO and the US FDA are still supporting the production with our partners at Cogenics, and they are supporting the production. And like I said, like the rapid diagnostic test kits and for both Ebola and Lassa are for emergency use. So they are not available yet for public use at the moment. And for the second question, that what is the return that Nigerians or any other community gets for helping out indirectly or directly for this product? So one of the things that Professor Christian Happy is championing now is that whatever product comes from Africa must return back to Africa for use at no profit, so that at least then Africans will know that, okay, this is what they stand to gain. It shouldn't be that a product is being developed from Africans and then they have to also now procure it at a very expensive price. But the challenge there is that even indigenous products are not being encouraged within the country. So I remember telling Dr. Eka about the vaccine candidates that we identified with our partner at Cambridge University. And when we spoke with the Nigerian government, the idea did not fly. The idea did not fly at all. So then what do we do as scientists? Are we going to let that idea die with us, or we take it out of the country? And that's exactly what has happened. And so it's kind of discouraging, even as much as we are producing indigenous products, but then the government is also not ready to support. But it's something that is forefront in the heart of Professor Happy and some other African scientists that any product that is developed from Africa must be returned to Africa for use at no interest or profit. The role of artificial intelligence, of course, you would agree with me that this is actually fast becoming the order of the day with respect to science. So we have this data science for Africa, where different research is able to generate data and then utilize the data for products that can address health challenges. And so it's actually it's not yet in its full implementation, but it's actually going to be the order of the day in the next couple of years. Thank you.
Thank you very much for those responses, and thank you very much for those questions as well. So we have one question from Professor Melanie Abbas, who's based here at King's College as well, the IOPPN, Institute of Psychology, Psychiatry, and Neuroscience. And she thanks you very much for the presentation and is asking you, Professor Folarin, to please give your views on the roles of universities in the Global North in conducting global health research and in delivering global health education.
Yeah, thank you very much for that question. I think prior to now, that is a pre-COVID era, the universities are maybe about 40% being involved in global research. But then during the COVID pandemic, I think universities and other research centers actually now realize how important it is to be involved in global research. And so they are now supporting their faculties and also helping the faculties to attract funds to be able to do those tractable research that can help in development of ideas and products, and also in innovation.
Thank you very much for that. Okay, okay, good. Thank you. Question here. Please ask. If you can come closer, that would be great. That probably help.
Professor, thank you for your presentation. Just something that caught my eye is the overarching goal of the center. I may not remember the whole caption, but what caught my eye was something about free from external influence, or something of that sort. If I'm wrong, just let me know. But I found that really ironic, considering much of, other than of course, the knowledge and all the data that you're producing is by Nigerians. The specimen are from the continent, west of Africa, but much of the support and collaboration that you have is from traditionally influencing organizations. So maybe just speak to that. Thank you.
Could you come again with your question? I'm not sure I
can. You want me to try and summarize?
Yes.
Thanks, Professor Folarin. So Esther, one of our students here, was noting that there is an objective, it seems, a central objective that is about being free from outside influences. And this it's an overarching goal, so quite central. And so she's raising a point here around how that is, how this goal is upheld alongside where dominant partners of the center are based or located. And perhaps I could add to that and say, especially if we think of the finance and the funding, some of the main partners we noted there, so I guess, how do we pull these together? Are there contradictions there, or are there synergies there? how to think of these two alongside one another, being free from outside influences, but also where funding is coming from and where partnerships are also located.
Oh, okay, so I get it. Actually, this free of outside influences is more about the environment in which we are in, not with respect to the funders. So we're talking about being able to do what we know best, not being influenced by the government, not being influenced, because we're based in the university and we're not being influenced by management of the university, even though we have a very wonderful management system in our university. But what this statement is talking about is that we do not have any form of influences from our environment, but we are able to do what we know to do best, not with respect to the funding.
Okay, thank you very much for that, Professor Folarin. Are there other questions or comments from the floor? If not, maybe I will now ask for one, and maybe I build on actually the point that's been made here. When we look at the range, and it's great to see the support that's coming to the center for this really important work. I noted that some support coming also from the African Union and from the Africa CDC. I'm not sure what support, if any, comes from the Nigerian government as well. But I'm curious as to, from your perspective, is that important? Is it important for us to be, should finance, especially finance, talking about support, finance from the continent, finance from Nigeria, is that something that is necessary for this endeavor?
Oh yes, it's very important because I don't know how, we were just lucky to have funders that believe in us, because if not, and we don't have any support from within the country, then it's I don't know how far we would have gone, but these outside funders believed in us and then they are able to support us. But truth be told, we're not getting any major support from within the country. What we are getting is, well, we try to get them along with what we do, but in terms of finances, no, we're not getting. But at the same time, we are within the country and we are doing public health services for the country. But it is very important that the government should support research institutes like ours, and not only about us, but any other research institute within the country. It is very important because it will definitely go a long way. There's the saying about charity begins at home, and it should also go with respect to support and funding.
Thank you very much for that. Another point, please.
So I'm Clement. I lecture at the African Leadership Center. And I have a very simple question, really. Very fascinating presentation, Prof. Well done. You guys are doing good stuff. Are you concerned that your progress is being stifled to any extent at all by regulatory environment in Nigeria? Because you did mention that the process of getting the drugs registered in the country can take time. Is that any concern at all to you, both within but also outside of the country, knowing that sometimes this can be very political, and even if you make a headway, the international community may not buy in. But anyway, do you think there's any concern for you in terms of how you get your product into the market in the end?
Yes, it is. It's of great concern to us because, like I mentioned, there's a need for the government to buy into the innovation that we are doing. Otherwise, it would just amount to a waste of effort. But thanks to the fact that we also have partners outside the country, and then they are able to take on what the product is. This is not good for the country, but if that is the way to go, well, we don't seem to have a choice, but it's of great concern. And that's why we keep trying to make sure that we carry them along to know the extent of what our research is. And hopefully one day they will buy into what we are doing and also buy into our products.
Thank you very much for that. Thank you for that question, and thanks very much for that response. One more question from colleagues online. And this question goes, oftentimes with partnerships and external funding, there tends to be tensions between the grant givers and the grantees in terms of delivery outputs. Do you feel this has ever been the case here? Or do you feel this has not been an issue in terms of carrying out the research that is needed? If I can add my own question to that, I would ask, I mean, there might be some arguments that, for instance, this production of this development of COVID vaccines, this work is being done in other parts of the world. There is no need for Nigeria to focus on that. Nigeria could rather just focus on trying to purchase those vaccines that are being produced elsewhere. Do you see a sort of political impetus, an actual need for Nigerians to be producing their own vaccines, even if these might exist elsewhere? And by extension, could we think about that sort of an argument for African scientists and African pharma establishments as well? Thank you.
Can you read the first question again?
Okay, so the first question is asking, or is saying that quite often partnerships and external funding, so I presume external, partnerships with external actors, external here I will read as outside of Africa. So those partnerships and that external funding tends to show tensions between the grant givers and the grantees. Yeah. Do you feel that this has ever been the case in terms of the delivery of outputs on your end, on the part of the center? Or do you feel like this has not really been an issue, or is not impeded, is not caused an impediment to the research that is being carried out?
Okay, thank you very much. So I'm going to start also in that order of the first question. Actually, we have never had that kind of issue. And what we do is we make sure that we come clean. And by coming clean, it means that we lay out our goals, plans, objectives out to the funders. And whenever there seems to be a change, we go back to our funders and explain things to them that, okay, this is the way this is going, and do we have your permission to continue in that direction? So we've never had any form of tension between us and our funders, because we try as much as possible to carry them along every step and all our processes. So the second question is whether there is a need for, if I can interpret it, like whether there's a need for indigenous vaccine, for instance, or indigenous product. Well, for me, I think yes, there is a need for Africans to also be able to contribute to product development, because these products they are indigenous with us, let's say. So if you look at the picture, the scenario with COVID, the fatality rate of the disease is completely different in Africa as against what you have in Europe or America. So something is definitely going wrong. I mean, going on, not wrong. Something is definitely going on that we need to understand. And so if we understand that major differences, then of course, then it would definitely lead to an indigenous product. And so there's a need for us to also contribute. That, for me, I believe that, yes, we should contribute. We should not leave everything to the West for development and for them to contribute to what actually is domiciled with us. So, well, COVID was a pandemic, but then you have other diseases that are actually present with us in Africa. So that, if we use the knowledge of COVID to develop any other one, then it's good. I think, yes, Africa needs to be encouraged to develop their own products. And I also believe that it might come out cheaper. But there are a lot of political issues that may not be for, I'm a scientist. I know that most of the people listening to me may probably be social scientists, and you would understand even beyond what I understand. So there are a lot of political issues going on that may not encourage the development of indigenous vaccine, but I think it's not something that we want to discuss here. Thank you.
Thank you very much for that, Professor. Oh, a very final point, very final, very final.
Okay. So, Prof, you mentioned one of the challenges being lack of expertise in data analysis. So I was curious about that, considering you are based at a university. So as a university, are you doing anything to address that challenge that seems easy to see? Thank you.
Oh, yes, we are actually doing that. So the university actually now has established, through also SGID, we have established a degree program in bioinformatics, and that is at a master's level and doctoral level. So this course will bring together both health scientists, computer scientists, mathematical scientists, and all of these group of people will come together that would train people who are interested in data science. So, and that takes us back to the question of artificial intelligence and all of that. So that's one way by which we are contributing to capacity building with respect to data and data analysis. Also, we run series of short courses, especially in bioinformatics and data science. That's like a 2-week course for people who are interested in data analysis. Thank you.
Thank you very, very much. Well, I want to say a huge thank you for taking your time to share this incredible work with us. It's really fantastic. It's very heartening to really see the efforts that have gone on, both in relation to COVID, which has drawn our attention to these conversations, but also all the other work going on with all these other infectious diseases that, you know, because they're not seen as priorities elsewhere. It's wonderful to see that actually in Nigeria, we're not waiting for priorities to come from elsewhere, and we are deciding what our own priorities actually are. It's been very inspiring to listen to you share this fascinating work with us, and it gives me certainly a huge sense of hope about what is already going on, not let alone what is to come. I also want to extend my thanks to Professor Onikepe. Thank you so much for taking time out to come and to share your own insights, you know, reflecting on this thought, reinterpreting some of this, because you sit, you know, the crux of this world and our world as well. So it's been hugely valuable to hear what you've shared with us here, and the bigger philosophical questions actually you put on the table. I hope we will all take with us and travel with, and thinking especially of a lot of the leadership scholars that are sitting in this room here. These are huge leadership questions that we are contending with today. Thank you very much to all of you that have joined us. Colleagues online, thank you so much for taking time to be with us. Those of you in the room, thank you so much for taking time to be with us. That day of a whole week of events and activities, so please stay with us through that. Enjoy some refreshments here before you go, and mingle and make friends as well, and have a wonderful evening. Thank you so much, Professor Folarin. Thank you very much.
No,我先去我们。Okay, every event my qualifications now if I make